The slap echoed through Mercy General Hospital's emergency department like a gunshot. Conversations stopped instantly. Monitors continued their steady beeping, but every human voice disappeared. 50 people stood frozen beneath the harsh fluorescent lights, staring at the young nurse whose head had snapped sideways from the force of the blow. Maya Thompson-Johnson slowly turned back toward the physician who had struck her. A bright red mark spread across her cheek. DeMarcus Williams stood tall in his expensive white coat, breathing heavily, convinced his authority protected him from consequences. Around them, patients, visitors, nurses, and medical students struggled to process what they had just witnessed. Outside, a cold Chicago rain tapped softly against the hospital windows. Inside, tension thickened the air until it felt difficult to breathe. Maya remained remarkably calm. Her dark eyes never left Dr. Williams. She reached into her scrub pocket and touched her employee keycard, not because she needed it, but because it reminded her who she was. The confrontation had started only moments earlier. A patient had arrived showing symptoms that suggested acute pancreatitis. Maya respectfully questioned the treatment plan after noticing laboratory results that raised serious concerns. Her voice had remained professional. Her tone had been respectful, yet the suggestion had triggered something ugly inside the senior physician. "Stay in your lane," Dr. Williams had barked. When Maya calmly continued advocating for patient safety, his anger exploded. The racial insult came first, then the slap. Now phones appeared throughout the emergency room. A nursing student named Jessica Martinez had already begun live streaming. A patient's son recorded from another angle. Within seconds, social media viewers climbed into the thousands. "Did everyone see that?" Jessica whispered into her phone. "A doctor just hit a nurse in the emergency room." Comments flooded the screen faster than she could read them. Maya's phone vibrated inside her pocket. She ignored it, then it vibrated again. And again. Across the room, charge nurse Carmen Rodriguez hurried toward her. "Maya, please," Carmen whispered urgently. "Just let this go. Doctors like him always win." Maya offered a small smile. "Not always," she replied. Nearby, another physician, Dr. Sarah Carter, looked deeply uncomfortable. "Marcus," she said carefully, "you need to apologize. Right now." Instead, he laughed. "Apologize for correcting an insubordinate employee." Several nurses exchanged worried looks. They had heard similar comments before. Many had experienced humiliation from physicians who viewed nurses as servants rather than colleagues. Yet nobody had ever seen it become physical. Security guard Morris Washington approached cautiously. "Doctor, is everything under control?" "Perfectly," Williams answered. "This nurse forgot her place." Maya glanced toward the large clock mounted above the nursing station, 8:52 p.m. Only 8 minutes remained until an executive board meeting scheduled weeks earlier. Her phone vibrated again. This time she checked the screen. 3 missed calls. A text message appeared beneath them. "Where are you? The board meeting starts shortly." Maya read the message without reacting. Dr. Williams noticed. "Calling your lawyer already?" Several people laughed nervously. "No," Maya answered quietly. "Then who?" She slipped the phone back into her pocket. "Someone important." The confidence in her voice unsettled him. For the first time, uncertainty flickered across his face. Rain continued falling outside as ambulance lights reflected across the emergency room windows. Inside, livestream viewers climbed past 4,000. Every second pushed the situation further beyond hospital walls. Maya looked around the room at the witnesses recording everything. She noticed frightened nurses, concerned patients, young medical students learning lessons nobody intended to teach. Then she looked back at Dr. Williams. "Before you make your next decision," she said calmly, "you should ask yourself one question." His smile faded. "What question?" Maya's expression remained composed. "Are you absolutely certain you know who you just slapped?" For the first time that evening, silence returned to the emergency room. And somewhere upstairs, an executive board meeting was beginning, without one of its most important attendees. Dr. Marcus Williams stood motionless beneath the fluorescent lights. The confidence that had fueled his outburst was beginning to crack. Maya's question lingered in the air like a storm warning. "What is that supposed to mean?" he demanded. Maya didn't answer immediately. Instead, she checked the time, 8:59 p.m., 1 minute before the executive board meeting. Her phone vibrated again. Across the emergency department, hospital administrator Patricia Webb burst through the automatic doors. Her heels struck the floor sharply as she hurried toward the crowd. The expression on her face told everyone she already knew something serious had happened. "What is going on here?" she demanded. The room erupted with overlapping voices. "He hit her. There are videos. Thousands of people are watching online. The whole thing was live-streamed." Patricia's eyes settled on Maya's reddened cheek. Then they moved toward Dr. Williams. "Marcus," she said carefully, "did you strike Nurse Thompson-Johnson?" "I defended myself against an insubordinate employee undermining medical authority," he replied. The explanation sounded weaker than he intended. "That's a lie," shouted an elderly patient from a nearby wheelchair. "We all saw it," added another witness. "He called her names first," someone else yelled. Patricia's face tightened. She pulled out her tablet and began reviewing incoming reports. Within seconds, Security Chief Tom Rodriguez entered the emergency room accompanied by 2 officers. Unlike the administrator, he looked alarmed. "Ms. Webb," he said quietly, "we need to speak immediately." "About what?" "Not here." His eyes briefly moved toward Maya. Patricia noticed. Her expression changed. "Tom," she whispered, "what aren't you telling me?" Before he could answer, the large digital clock changed. 9:07 p.m. The board meeting officially began upstairs. At that exact moment, Maya's phone rang. Everyone nearby could see the caller ID. "Dad." Dr. Williams laughed. "Calling your father? Really?" Maya answered calmly. "Hi, Dad." The room remained silent. "Yes," she continued, "I'm still in the ER. There was an incident." Security Chief Rodriguez closed his eyes briefly. Patricia Webb looked like she had suddenly forgotten how to breathe. "No," Maya said into the phone, "I'm not seriously injured." Pause. "Yes, there are witnesses." Another pause. "And video evidence." Patricia's tablet emitted a notification tone. She glanced at the screen. The color drained from her face. Dr. Williams frowned. "What?" She didn't answer. Instead, she stared at Maya, then at the tablet, then back at Maya. "No," she whispered. Tom Rodriguez rubbed his forehead. "That's what I've been trying to tell you." "Tell me what?" Dr. Williams snapped. Nobody answered immediately. The livestream audience had surpassed 7,000 viewers. Comments raced upward. People sensed a revelation approaching. Finally, charge nurse Carmen Rodriguez spoke. "Wait," she said slowly. "Your last name is Thompson-Johnson." Maya nodded. Carmen's eyes widened. "As in Director James Thompson?" The emergency room fell silent again. Dr. Williams laughed nervously. "That's ridiculous. There are thousands of Thompsons." Nobody joined his laughter. Maya ended her call. A new message immediately appeared on her screen. "Conference room A. Bring witnesses." She showed the message to Patricia. The administrator swallowed hard. "He knows." "Of course he knows," Maya replied. Dr. Williams stared between them. Confusion was rapidly becoming fear. "Someone explain this," he demanded. Maya slowly removed her employee badge. The plastic holder had cracked during the confrontation. She held it up. Several people moved closer. The text beneath her name became visible. Maya Thompson-Johnson, RN, MSN, employee number 0001, Director Family Authorization. A collective gasp swept through the room. The live stream exploded with reactions. Jessica nearly dropped her phone. "No way," she whispered. Dr. Williams stared at the badge, then stared at Maya, then looked at Patricia. Nobody contradicted what he was seeing. The realization hit him slowly. Then all at once, the nurse he had publicly humiliated, the woman he had slapped in front of patients, the employee he had mocked and insulted, was the daughter of Mercy General Hospital's director, and she had been quietly working beside him for years. Maya slipped the badge back into place. "Dr. Williams," she said softly, I think it's time for us to go upstairs." As the elevator doors opened across the hallway, another notification arrived on Patricia Webb's tablet. This one carried a subject line that made her stomach drop. "Emergency legal review initiated." And for the first time that night, Dr. Marcus Williams truly understood how much trouble he was in. The elevator doors closed with a soft metallic sound. For a brief moment, the chaos of the emergency department disappeared behind steel walls and silence. Maya stood calmly beside Jessica Martinez, who still held her phone with trembling hands. The live stream audience had crossed 10,000 viewers. Comments poured across the screen faster than either woman could read them. "I still can't believe this," Jessica whispered. Maya smiled faintly. "Believe what?" "That you're the director's daughter and you've been working here as a regular nurse." "That's exactly why I worked here," Maya replied. Jessica frowned. "I don't understand." The elevator began climbing. "People act differently when they think power is watching," Maya said quietly. "I wanted to see how people behaved when they thought nobody important was paying attention." The answer stayed with Jessica as the elevator reached the executive floor. When the doors opened, Maya stepped into a world few hospital employees ever visited. The fourth floor was quiet, elegant, and insulated from the constant pressure below. Framed photographs lined the walls, soft lighting reflected from polished wood floors. Outside the large windows, Chicago's skyline glowed beneath rain-soaked clouds. At the end of the corridor stood Conference Room A. The heavy oak doors were already open. Inside, 12 board members sat around a long mahogany table. At its head sat James Thompson. The hospital director's face revealed little emotion, but Maya knew him well enough to recognize the anger hidden beneath his calm expression. Beside him sat board chairman Robert Mills, a retired attorney with a reputation for solving difficult crises. Tonight, however, he looked deeply unsettled. Every conversation stopped when Maya entered. "Are you hurt?" her father asked immediately. Maya touched the fading mark on her cheek. "Nothing permanent." James Thompson nodded slowly. His jaw tightened. That reaction worried Maya more than any display of anger could have. When her father became quiet, important decisions usually followed. Chairman Mills gestured toward an empty space near the projection screen. "Please tell us exactly what happened." Maya placed a small flash drive onto the conference table. "Before I do," she said, "I need everyone here to understand something." Several board members exchanged confused looks. Maya connected her laptop to the conference room display. The large screen illuminated. A spreadsheet appeared. Then another, hundreds of pages. Dates, names, witness statements, incident reports, documentation. The room grew noticeably quieter. "What is this?" asked board member Evelyn Carter. Maya looked directly at her. 5 years of evidence. Nobody spoke. She clicked again. The screen displayed a title: Workplace Harassment Documentation Program, 2019 to 2024, Mercy General Hospital. Several people leaned forward. James Thompson slowly removed his reading glasses. Even he had not seen the complete file before. "Maya," he said carefully, "how much evidence have you collected?" 832 documented incidents. The answer landed like a bomb. Board members stared at one another. Some looked shocked, others looked worried. A few looked guilty. "You're telling us there have been more than 800 harassment incidents inside this hospital?" Mills asked. "Documented incidents," Maya corrected. "The actual number is likely much higher." Silence returned. Rain continued striking the windows. Far below, ambulance lights flashed red and blue against wet pavement. Inside the conference room, a much larger emergency was unfolding. Maya opened another folder, the screen filled with names: nurses, technicians, support staff, residents, individuals who had reported discrimination, intimidation, retaliation, or abuse. "This isn't just about Dr. Williams," Maya said. "Then why didn't you bring this forward sooner?" one board member asked. Maya paused. The answer mattered. Because one complaint can be dismissed. 10 complaints can be explained away. 100 complaints can be questioned. She looked around the room. 832 incidents become impossible to ignore. Nobody challenged her logic. Jessica watched from the corner, stunned. The live stream audience continued growing. Nearly 12,000 people were now watching events unfold in real time. Maya clicked once more. A final document appeared. Projected legal exposure, estimated financial risk, $94 million. Several board members visibly stiffened. Chairman Mills leaned back slowly. Good Lord, Maya folded her hands. Tonight wasn't the beginning of a problem. She allowed the words to settle. Tonight was simply the moment the problem became impossible to hide. At that exact moment, someone knocked on the conference room door. Security Chief Tom Rodriguez entered. Behind him stood Dr. Marcus Williams, and judging by the expression on his face, he had no idea what he was about to walk into. Dr. Marcus Williams entered conference room A with the confidence of a man who still believed influence could save him. That confidence lasted exactly 3 seconds. His eyes moved from the board members to the massive screen behind Maya. Then he noticed the spreadsheets, the documentation folders, the legal projections. Finally, he saw James Thompson sitting at the head of the table. The hospital director's expression was cold enough to freeze the room. For the first time all evening, genuine fear appeared in Dr. Williams's eyes. "What's going on?" he asked. Nobody answered immediately. Security Chief Rodriguez quietly closed the door behind him. The sound echoed through the room. Chairman Robert Mills folded his hands. "Please take a seat, Doctor." The request sounded less like an invitation and more like a command. Dr. Williams sat. Maya remained standing near the projection screen. The fading bruise on her cheek was still visible. No one in the room could ignore it. "This is ridiculous," Williams said. "I've already explained what happened. She challenged my authority in front of patients." Maya said nothing. Instead, she clicked a button. The conference room speakers came alive. The recording began. Everyone heard his voice. "Listen up, girl. You ghetto nurses need to know your place." The room fell silent. The recording continued. "Fetch coffee, empty bedpans, and keep your mouth shut." Then came the unmistakable sound of the slap. Several board members visibly flinched. Dr. Williams looked away. The audio ended. Nobody spoke for several seconds. Outside the windows, lightning flashed above downtown Chicago. Inside, the atmosphere felt heavier than before. "Do you dispute the authenticity of that recording?" Chairman Mills asked. Williams cleared his throat. "Context matters." "Does it?" Maya asked quietly. The question struck harder than an accusation. Williams looked at her. For years he had viewed Maya as insignificant, a nurse, a subordinate, someone who should listen rather than speak. Now she stood before him with complete composure while an entire board of directors listened to every word she said. The power dynamic had shifted, and he knew it. Human Resources Director Lisa Park opened a thick personnel file. "Dr. Williams," she began, "before tonight, had you ever received complaints regarding workplace conduct?" His face tightened. "A few misunderstandings." Lisa opened the file. 27 documented complaints over 6 years. The room became noticeably quieter. "Those complaints resulted in no disciplinary action," Williams quickly replied. "Correct," Lisa answered, "which may become a separate issue." Maya clicked another slide. The screen displayed a timeline. Hundreds of incidents stretched across 5 years. Patterns emerged immediately. The same names, the same departments, the same behaviors. Board members stared at the evidence. No one appeared comfortable. "What exactly are we looking at?" asked board member Carter. Maya folded her arms. "A culture problem." She pointed toward the screen. Not every incident involved Dr. Williams, but many followed the same pattern: intimidation, disrespect, retaliation against staff who spoke up. Williams shook his head. "You're exaggerating isolated events." "Am I?" Maya pressed another key. The next slide appeared. Employee turnover statistics. Emergency department nursing staff. 5-year trend. The numbers were alarming. Resignations had steadily increased. Exit interviews revealed similar concerns: hostile work environments, lack of support, fear of retaliation. Board Chairman Mills slowly removed his glasses. "These numbers are devastating." "They're expensive too," Maya replied. A new slide appeared. Estimated cost of staff turnover, $23 million. Williams shifted uncomfortably. The situation was slipping beyond his control. For years he had relied upon reputation and status. Neither seemed useful tonight. James Thompson finally spoke. His voice remained calm. That made it even more intimidating. "Marcus, did you strike my daughter?" No titles, no formal language, just a father asking a question. Williams hesitated. The hesitation answered everything. James Thompson nodded slowly. His eyes never left the physician. Then before this meeting continues, he said, "You should understand one thing." The room focused entirely on him. "My concern tonight isn't that you assaulted my daughter." Williams looked confused. Several board members appeared equally surprised. James leaned forward. "My concern is that you believed you could assault any employee and suffer no consequences." The words landed with tremendous force. Nobody moved. Nobody spoke. Then Lisa Park slid a single document across the table toward Dr. Williams. He looked down, his face turned pale. The heading was impossible to miss. Notice of immediate employment review. And suddenly, Dr. Marcus Williams realized this meeting was not about defending himself. It was about determining how much of his career would survive the night. Dr. Marcus Williams stared at the document in front of him. The words seemed unreal. Notice of immediate employment review. For 15 years, he had been one of Mercy General's most influential physicians. He had chaired committees, mentored residents, and enjoyed privileges few doctors ever received. Now those accomplishments felt distant, fragile, almost irrelevant. Across the table, Maya remained calm. She wasn't smiling, she wasn't celebrating. That unsettled him more than anger would have. Chairman Mills broke the silence. "Dr. Williams, before this board proceeds, you have an opportunity to explain your actions." Williams straightened his tie. Old instincts returned: confidence, authority, control. "I've dedicated my life to medicine," he began. "One emotional moment shouldn't erase 15 years of service." Several board members listened carefully. Maya said nothing. "Emergency departments are stressful environments," he continued. "People make mistakes." "People do make mistakes," Maya agreed. The physician looked relieved. Then she continued, "The problem is that mistakes usually happen once. Patterns happen repeatedly." The relief vanished immediately. She pressed another key. A new slide appeared. Documented incidents involving Dr. Marcus Williams. Years, 2019 to 2024. Total complaints, 47. The room became silent. Williams stared at the screen. "That's impossible." "Actually," Maya replied, "that's verified." The first case appeared: a nurse publicly humiliated during a trauma response. The second, a resident verbally threatened after questioning medication dosage. The third, a technician transferred following retaliation complaints. The fourth, the fifth, the sixth. One after another, a disturbing pattern emerged. Not every incident involved race. Not every incident involved physical aggression. But nearly all involved abuse of authority. Several board members exchanged uncomfortable glances. Many had never seen the complete picture. Maya had spent years assembling it. "Why weren't these addressed earlier?" asked board member Evelyn Carter. Human Resources Director Lisa Park sighed. Most complainants withdrew reports. Others feared retaliation. Some left the hospital entirely. The answer weighed heavily on the room. Outside, rain continued falling across Chicago. Inside, years of hidden problems were finally becoming visible. James Thompson looked toward his daughter. "How many people helped you gather this information?" "Very few," Maya answered. "Why?" "Because most employees believed nothing would change." That statement struck harder than any accusation. For years, Mercy General had promoted itself as a leading medical institution. Award-winning, respected, progressive. Yet beneath the reputation, many employees had quietly stopped believing their concerns mattered. Maya clicked again. The next slide displayed resignation statistics. The emergency nursing department had lost nearly 1/3 of its experienced staff during 5 years. Exit interviews filled the screen. Fear, harassment, burnout, retaliation, lack of accountability. Williams shook his head. "You're blaming me for everything wrong in this hospital." "No," Maya replied. "Then what are you doing?" She met his eyes, showing what happens when leadership ignores warning signs. The answer landed heavily, because everyone in the room understood she wasn't speaking only about him. The board itself was being challenged. Their oversight, their decisions, their failures. Chairman Mills leaned back slowly. "She's right." Nobody argued. The chairman looked around the table. This hospital has a physician problem. Then he paused. But more importantly, we have a leadership problem. Several board members lowered their eyes. The criticism was deserved. Maya advanced to another slide. Projected public relations impact. The numbers were staggering. Video views across platforms had already exceeded 200,000. Major news organizations were requesting interviews. Local television stations were preparing coverage. National healthcare publications had begun contacting the hospital. The story was spreading faster than anyone anticipated. Williams looked increasingly desperate. We can still control the narrative. Jessica Martinez, who had remained quietly in the corner, finally spoke. No, you can't. Every eye turned toward her. The nursing student swallowed nervously. The live stream has been downloaded thousands of times. People already copied it. It's everywhere. Silence followed. The reality was unavoidable. The incident no longer belonged to Mercy General. It belonged to the public. Maya glanced at the clock. 9:28 p.m. Only 30 minutes had passed since the slap, yet everything had changed. Then another notification appeared on her phone. She read it carefully. Her expression remained calm, but Chairman Mills noticed. What is it? Maya slowly looked up. Channel 7 News just arrived outside. The room grew still. They're not alone, she added. 3 other news stations are setting up cameras in the parking lot. Outside the conference room window, flashing lights were becoming visible below. And for the first time that evening, the board realized this crisis was no longer an internal matter. By sunrise, the entire city would know what happened inside Mercy General Hospital. By 10 o'clock p.m., Mercy General Hospital had become the center of Chicago's biggest local news story. Rain continued falling across the city as satellite trucks lined the hospital parking lot. Reporters stood beneath umbrellas, speaking into cameras while bright lights reflected from wet pavement. Inside Conference Room A, nobody was thinking about public relations anymore. The conversation had shifted toward survival. Chairman Robert Mills stared at the growing stream of news alerts appearing on his tablet. 4 television stations, he said quietly, 3 newspapers, 2 national healthcare publications. Nobody seemed surprised. The story contained everything modern media loved: power, race, violence, healthcare, institutional failure, and a shocking twist. The victim wasn't simply a nurse, she was the hospital director's daughter. Across the room, Maya reviewed new messages arriving every few seconds. Former employees were reaching out. Current employees were reaching out. People she had never met were sharing similar experiences. The volume was overwhelming. How many? Asked her father. Maya looked up. 72 messages so far. Since when? The last hour. The answer unsettled everyone, because it suggested something larger than a single incident, something deeper, something systemic. Maya opened one message. Former emergency nurse, resigned 3 years earlier, reported harassment twice. Nothing happened. Another message. A respiratory therapist. Transferred departments after retaliation concerns. Another. A resident physician. Left the hospital entirely. The stories shared a common theme. People stopped speaking because they stopped believing anyone would listen. Board member Evelyn Carter rubbed her forehead. We've been blind. Not blind, Maya corrected gently. Comfortable. The distinction mattered because blindness implied ignorance. Comfort implied choice. No one challenged her observation. Meanwhile, 2 floors below, Dr. Marcus Williams sat alone inside a temporary conference room. His hospital access had been suspended, his email account deactivated, his identification badge disabled. 15 years of authority had disappeared within an hour. For the first time in his professional life, he was completely powerless. Security Chief Rodriguez stood nearby. Neither man spoke. Williams continued staring at his phone. The same headlines appeared repeatedly. Doctor assaults nurse during shift. Hospital investigation underway. Video sparks public outrage. Every headline felt like another door closing. Back upstairs, Human Resources Director Lisa Park entered Conference Room A carrying additional files. I've completed a preliminary review, she announced. The room immediately focused on her. How bad is it? Chairman Mills asked. Lisa placed several folders onto the table. Worse than we thought. Nobody liked that answer. She opened the first folder. Over the last 6 years, complaints involving senior physicians were frequently redirected rather than investigated. James Thompson frowned. Redirected by whom? Lisa hesitated. Department leadership. The room grew colder. Everyone understood what that meant. People had protected powerful individuals. Not patients, not staff, not the institution. Individuals. Maya remained silent. The evidence was beginning to speak for itself. Lisa continued, additionally, we've identified 3 settlements involving former employees who signed confidentiality agreements. Several board members sat upright. Settlements? Carter asked. Why weren't we informed? Because they were classified as employment disputes rather than discrimination cases. Chairman Mills looked furious. How much? Lisa opened another page. Approximately $1.8 million combined. Nobody spoke. The number was shocking. Not because of its size, because of what it represented. Problems had existed for years, and people had quietly paid to make them disappear. Maya looked toward the rain-covered windows. The city lights shimmered against the darkness. For years, she had wondered whether documenting everything would matter. Tonight she finally had her answer. Documentation mattered, truth mattered, preparation mattered. Then her phone rang. The caller surprised her. Harvard School of Nursing. Several board members noticed her expression. You should answer, Mills said. Maya stepped toward the window. Hello. A familiar voice greeted her. Professor Rebecca Lawrence, her graduate advisor. Maya, the professor said, I've been watching the coverage. Maya laughed softly. News travels fast. Not this fast, Rebecca replied. What do you mean? There was a brief pause. Then came words Maya never expected to hear. The Department of Health and Human Services just contacted us. Maya's expression changed. Several board members immediately noticed. Why? She asked. Professor Lawrence exhaled slowly. Because your documentation project may become the foundation for a national healthcare workplace reform initiative. For the first time that night, Maya was speechless. The room watched her carefully. When the call ended, Chairman Mills spoke. Maya? She slowly lowered her phone. The rain continued falling outside. News cameras continued broadcasting below. And suddenly the crisis at Mercy General seemed much larger than a single hospital. Ladies and gentlemen, Maya said quietly, I think this just became a national story. The conference room remained silent long after Maya delivered the news. A national story. Those 3 words carried enormous weight. Outside, television crews continued broadcasting live from the hospital parking lot. What had started as a workplace confrontation was rapidly becoming something much larger. Chairman Robert Mills leaned forward. Explain exactly what that means. Maya placed her phone on the conference table. The Department of Health and Human Services has been reviewing workplace violence in healthcare facilities nationwide. My documentation project is now being considered as part of a federal study. The board members exchanged stunned looks. Federal involvement? Asked Evelyn Carter. Potentially, Maya replied. How significant? Maya hesitated. Very significant. No one spoke. The hospital had spent decades building its reputation. Now that reputation was being examined under a national spotlight. James Thompson stood and walked toward the window. Below, flashing lights reflected off rain-covered pavement. Reporters continued arriving. The crowd was growing. We need to get ahead of this, he said. Chairman Mills nodded. Agreed. Lisa Park opened another folder. There is additional information you need to see. The tension immediately returned. Nobody liked those words anymore. Every new document seemed to reveal another hidden problem. Lisa distributed copies around the table. Several board members began reading. Their expressions changed almost immediately. Concern became alarm. Alarm became disbelief. Finally, Mills looked up. These numbers can't be correct. Unfortunately, they are, Lisa answered. The report detailed employee retention statistics. Mercy General had lost nearly 40% of its experienced nursing staff over 7 years. The cost exceeded $30 million. Recruitment, training, overtime, temporary staffing. The financial damage was staggering. and much of it had been hidden inside routine operational budgets. "We've been bleeding talent for years," Carter whispered. Maya nodded. "Good nurses don't usually leave because of patients." The statement resonated throughout the room. Everyone knew it was true. Most healthcare professionals entered medicine to help people. What drove them away often had nothing to do with patient care. It was culture, respect, leadership, accountability. At 10:37 p.m., another unexpected development arrived. Security Chief Rodriguez entered quickly. His expression was unusually serious. "Director Thompson, we have a situation downstairs." The room immediately focused on him. "What happened?" James asked. Rodriguez exhaled heavily. "Former employees are gathering outside the hospital." Nobody understood. "Gathering for what?" Mills asked. The chief looked toward Maya. "To support her." Silence followed. Then he continued. Word spread online. Nurses, technicians, former residents, even retired staff members are showing up. Maya blinked. "How many?" "Over 60 so far." The room fell quiet. Not protesters, not activists, healthcare workers, people who had once walked the same hallways. People who had quietly endured their own struggles. People who saw part of their story in Maya's. James looked through the rain-covered glass. From the fourth floor, small groups were visible gathering near the hospital entrance. Umbrellas dotted the darkness. More cars continued arriving. Something emotional was happening. Something spontaneous. Something impossible to organize in advance. Maya felt a lump forming in her throat. For 5 years she had collected evidence. For 5 years she had wondered whether anyone else noticed the same problems. Now she had her answer. They had noticed. They had simply felt powerless. A notification appeared on Jessica's live stream. Viewer count 43,000. The room stared at the number. The audience was no longer local. People across the country were watching, listening, sharing, discussing. Then another message arrived on Maya's phone. This one came from someone she had not heard from in years. To Benjamin Carter, former resident physician, left Mercy General 4 years earlier. The message contained only one sentence. "Thank you for finally saying what the rest of us were afraid to say." Maya stared at the screen. The words affected her more than she expected, because they confirmed something important. This had never been about one slap. The slap was simply the moment the silence ended. Then Security Chief Rodriguez received another call. His expression immediately changed. "Director Thompson," he said carefully. "There's something else." James turned. "What now?" Rodriguez swallowed. "The State Medical Board just contacted the hospital." Every person in the room froze. The chief looked directly at Maya. "They're opening an emergency investigation first thing tomorrow morning." The room fell silent, because everyone understood what that meant. The consequences were no longer limited to Mercy General. By sunrise, Dr. Marcus Williams wouldn't be the only career under investigation. The entire hospital leadership structure was about to face scrutiny. At 6:15 a.m. the following morning, Mercy General Hospital looked less like a medical facility and more like the center of a national controversy. News vans occupied nearly every available parking space. Reporters stood along the sidewalks despite the cold rain. Camera crews adjusted equipment while producers coordinated live broadcasts. The story had spread far beyond Chicago. Inside the executive conference room, Maya had been awake for almost 24 hours, yet she showed no signs of exhaustion. Years of preparation had led to this moment. She reviewed documents while board members gathered around the long mahogany table. No one was discussing damage control anymore. The conversation had shifted toward accountability. At exactly 7:00 a.m., the State Medical Board investigators arrived. 3 individuals entered the hospital carrying briefcases and official credentials. Their leader, senior investigator Richard Lawson, wasted no time. "We're here regarding Dr. Marcus Williams and related institutional concerns," he announced. The room immediately grew tense. Lawson placed several folders on the table. "We received multiple complaints overnight." Chairman Mills frowned. "Multiple?" 31 so far." The answer stunned everyone. Many complaints came from former employees. Others came from current staff members who finally felt safe enough to speak. The investigators began reviewing evidence, video recordings. Witness statements, personnel files, harassment reports, settlement agreements. The process lasted hours. Around noon, Lawson requested a private conversation with Maya. They moved into a smaller conference room overlooking downtown Chicago. Clouds hung low above the skyline. Traffic crawled through rain-soaked streets below. For several moments, neither spoke. Then Lawson closed his notebook. "I've been conducting healthcare investigations for 23 years. Maya listened quietly. "I've never seen documentation this thorough." The compliment surprised her. "I wasn't building a case," she replied. "Then what were you doing?" Maya looked out the window, trying to understand why good people kept leaving. Lawson nodded slowly. The answer seemed to resonate with him. Back downstairs, another unexpected development was unfolding. Dozens of employees had gathered in the hospital cafeteria during lunch. No one organized the meeting. No one announced it. People simply showed up. Nurses, technicians, therapists, residents, support staff. Many wanted to share experiences they had kept private for years. Others simply wanted to listen. For perhaps the first time in hospital history, conversations about workplace culture were happening openly. Not behind closed doors, not in whispered hallways. In public, several local news stations began reporting on the gathering. The story continued growing. By late afternoon, national networks joined the coverage. Healthcare unions issued statements. Professional nursing organizations offered support. Medical schools requested interviews. The ripple effect expanded rapidly. Meanwhile, Dr. Marcus Williams remained at home. His phone rang constantly. Attorneys, reporters, former colleagues, family members. He ignored most calls. His world had narrowed dramatically. Television screens displayed his photograph. Social media platforms replayed the video endlessly. Everywhere he looked, consequences followed. At 5:30 p.m., the board reconvened. The investigators had completed their preliminary review. Everyone waited for Lawson's findings. The senior investigator stood. The room became silent. "Our preliminary conclusion is straightforward," he began. No one moved. "The evidence supports immediate disciplinary action against Dr. Williams." Several people nodded. The conclusion seemed inevitable. Then Lawson continued. "However, the larger concern involves organizational oversight failures." A heavy silence followed. The board members understood exactly what he meant. The investigation wasn't stopping with one physician. Leadership decisions would also face scrutiny. The room absorbed the reality. For years, warnings existed, complaints existed, evidence existed. Yet meaningful action never arrived. Until now. As the meeting ended, Maya remained seated. The city lights gradually appeared beyond the windows. Chicago was transitioning from afternoon into evening. Another long day was ending. James Thompson approached his daughter. "How are you holding up?" Maya smiled faintly. "Honestly? Always." She looked toward the city. "I thought the hardest part would be speaking up." "And? The hardest part is realizing how many people were waiting for someone else to speak first." James nodded thoughtfully. Neither spoke for several moments. Then Maya's phone vibrated. A new email had arrived. The sender caught her attention immediately. United States Senate Committee on Health. Her heartbeat quickened. She opened the message. After reading the first paragraph, she slowly lowered the phone. "Dad," she said quietly. "What is it?" Maya looked up. A mixture of disbelief and determination filled her eyes. "I think Washington wants to hear this story too." And suddenly, Mercy General's crisis seemed destined to reach an even bigger stage. 3 weeks later, Maya Thompson-Johnson stood beneath the marble columns of a federal building in Washington, D.C. The autumn air felt crisp and sharp. Reporters crowded the entrance while cameras tracked every movement. She never imagined that a single night inside a Chicago emergency room would bring her here. Yet the evidence she had collected for 5 years had become impossible to ignore. The Senate Committee on Health had invited her to testify regarding workplace violence, discrimination, and accountability in American healthcare. As Maya entered the building, she thought about the nurses still working overnight shifts across the country, the exhausted professionals caring for patients while struggling against systems that often ignored their voices. Those people were the reason she came, not for recognition, not for publicity, for change. Inside the hearing chamber, senators, healthcare executives, policy advisors, and journalists filled the room. The atmosphere felt serious, historic even. Many understood that the discussion could influence national healthcare policy. Maya took her seat. Her father watched quietly from the audience. Nearby sat Jessica Martinez, now preparing to graduate nursing school. Several former Mercy General employees occupied other seats, people who once felt invisible, people who finally felt seen. The hearing began. Questions came quickly. Some focused on workplace culture. Others focused on hospital accountability. Several senators asked about the documentation process. Maya answered calmly, methodically, professionally. Years of preparation made the testimony feel natural. Then Senator Elizabeth Harper asked a question that changed the room. Ms. Thompson-Johnson, what was the most important lesson from this experience? Silence followed. Maya considered the answer carefully. Then she spoke. The biggest lesson is that bad systems survive when good people believe they are powerless. The chamber became still. Most employees already knew the problems existed, Maya continued. The challenge wasn't awareness. The challenge was fear. Several senators nodded. The statement resonated beyond healthcare. It applied to many institutions, many workplaces, many communities. Maya continued, when people believe reporting won't matter, silence becomes normal. Silence protects dysfunction. Accountability changes that. The hearing lasted nearly 4 hours. By the end, multiple senators expressed support for stronger workplace protection measures. National healthcare organizations publicly endorsed several recommendations. Media coverage expanded further. What began as a hospital incident was now influencing policy discussions across the country. Back in Chicago, Mercy General continued changing. The reforms Maya proposed were producing measurable results. Employee retention improved dramatically. Patient satisfaction increased. Complaint reporting became more transparent. Most importantly, staff members felt safer speaking openly. The culture was far from perfect. But it was improving, and improvement mattered. One evening, nearly 6 months after the incident, Maya walked through the same emergency department where everything began. The atmosphere felt different. Conversations were more collaborative. New reporting systems existed. Leadership training programs had expanded. Employees seemed less afraid. As she passed the nursing station, several younger nurses greeted her warmly. One stopped her. "Can I ask you something?" "Of course," Maya replied. The nurse hesitated. "How did you stay calm that night?" Maya thought about the question. Then she smiled. "I wasn't calm because I wasn't afraid." The nurse listened carefully. "I was calm because I spent years preparing for the moment when the truth finally mattered." The answer stayed with the young nurse long after Maya walked away. That evening, Maya returned to her office overlooking downtown Chicago. The city glowed beneath a winter sunset. Snowflakes drifted past the windows. Her phone buzzed with a news notification. A federal healthcare reform proposal had officially been introduced. Several provisions mirrored recommendations discussed during her testimony. Maya stared at the screen. A quiet sense of gratitude filled her, not because she had won, because progress had begun. Then another email arrived. This one came from the State Medical Board. The subject line was brief. Final decision issued. Maya opened the message. As she read the contents, her expression changed. The decision was far more significant than anyone expected, and it guaranteed that the final chapter of Dr. Marcus Williams's story would soon become public. The email remained open on Maya Thompson-Johnson's computer screen as snow drifted across the Chicago skyline. For several moments, she simply stared at the words. After months of investigations, hearings, testimony, and review, the State Medical Board had reached its final decision. Dr. Marcus Williams' medical license had been permanently revoked. No suspension, no probation, no opportunity for reinstatement. Permanent revocation. The board concluded that his conduct demonstrated a pattern incompatible with the responsibilities of medical practice. The decision immediately became public. News organizations across the country reported the outcome. For many people, it represented justice. For others, it represented accountability long delayed. For Maya, it represented something more complicated. She felt no satisfaction, no triumph, only reflection. Because the real story had never been about one doctor. The real story had always been about a system. And systems only improve when people are willing to confront uncomfortable truths. Over the following months, Mercy General continued transforming. Independent auditors praised the hospital's transparency. Employee turnover reached its lowest level in over a decade. Patient satisfaction scores climbed steadily. Several hospitals across Illinois adopted similar reporting programs. Others followed throughout the country. The changes were not perfect. Progress rarely is. But they were real, and real progress saves lives. One spring morning, Maya returned to the emergency department where everything began. The bruise from that night had long disappeared. The memories had not. She paused near the nursing station. New employees moved confidently through the department. Experienced nurses collaborated openly with physicians. Questions were encouraged, concerns were addressed, respect felt normal. That was the goal all along. Not punishment, not revenge, respect. As Maya watched the department operate, she noticed a framed photograph hanging on a nearby wall. The image showed a diverse group of nurses, physicians, technicians, and support staff standing together. Beneath the photograph was a simple inscription: "Every voice matters." Maya smiled. The message captured everything she had spent years trying to prove. Later that afternoon, she received another invitation. This one came from a national healthcare leadership conference in Boston. Organizers wanted her to deliver the keynote address. The topic was simple: building cultures of accountability and respect. Months earlier, the invitation would have seemed impossible. Now it felt like responsibility. When the conference finally arrived, thousands of healthcare professionals filled the auditorium. Nurses, doctors, administrators, students, leaders, future leaders. Maya stepped onto the stage. The audience applauded. Then the room became quiet. She looked across the crowd, people from every background, every specialty, every corner of American healthcare, waiting, listening, hoping. Maya began with a story, not about the slap, not about the investigations, not about the headlines. She spoke about a young nurse who believed patient safety required courage. A nurse who learned that speaking up can be difficult, but staying silent can be far more costly. By the time she finished, many audience members stood. Some applauded, some wiped away tears, others simply reflected. Because the lesson extended beyond hospitals. Dignity matters, respect matters, character matters, and the willingness to stand for what is right matters most of all. That evening, as Maya prepared to leave the conference center, her phone buzzed. A message from Jessica Martinez appeared. "Guess what? I officially passed my nursing boards today." Maya laughed. Then another message arrived. "You inspired more people than you'll ever know." Maya stared at the screen. Outside, the lights of Boston shimmered against the harbor. For a moment, she thought about everything that had happened. The humiliation, the uncertainty, the long nights, the difficult choices, the unexpected opportunities. The lives changed along the way. Then she put away her phone and walked into the evening, confident, hopeful, at peace, because she finally understood something important. One act of courage cannot fix every problem, but it can inspire thousands of others to find their own voice. And sometimes that is enough to change an institution, enough to change a profession, enough to change a nation. Thank you for joining this story. If it moved you, inspired you, or reminded you of someone who deserves respect, remember to support those who speak up when it matters most. Subscribe to the channel, leave a comment, and share this video.